Good afternoon, Dr. Anam Alam. You are an alumni from DPS Noida from the batch of 2015. You have done your science stream, PCB, and then you have graduated doing BDS from Rohilkhand University. And now you are preparing for your master's in dentistry. So it's nice to have you. So before we start, our topic is some myths relating to dentistry and cleaning of teeth. I would like to ask you what inspired you to become a dentist.
Actually, hi Akash, hi everyone. I'm Dr. Anam Alam. My road to dentistry and everything, I would basically start by saying that my initial plan was not to become a dentist. Obviously, I think like 60 to 70% of people actually don't want to become a dentist when they are actually, preparing for the NEET exam and everything. So mainly I got my inspiration from my maternal uncle, and he is basically an eye surgeon and he's practicing in Meerut. So I used to, whenever I used to go to my grandmother's house, I used to just, watch him just talking to the patients and everything, and, prescribing them treatments and stuff. So I was really inspired by him, by the work he was doing. And he used to just say that, whatever you do, you should just do something which helps you earn respect from people. So that is what was like the crux of the whole thing, that I really wanted to do something to, for the greater good, like for the humanity and stuff. So the first inspiration came from there. And secondly, my parents also supported me a lot. They motivated me at every step that, I was very interested in academics, like from the start. So they were like, you should do this, you are capable of doing all of this, and you should help people and that. So mainly I wanted to be a gynec. Okay. But then some things happened, like I passed my 12th and everything with 96%, and I was like in that state of mind that okay, I am like the topper of my the science stream and everything, so I can just do everything that I want and I can get a government seat and everything. So but then I dropped a year, and then some things were not up to the mark. My preparation maybe was not up to the mark, and somehow I I got lost, like mid-track. So, and then also the exam which was supposed to be conducted, like the UPCPMT which was supposed to be conducted, it got scrapped off. And then came the NEET and everything. So the whole pattern of the exams was changed just 2 days before my exam, right? So I was already so much stressed and everything, and I couldn't cope with it. So maybe somewhere down the line, it was, I think, the best for me also, but at that time I was not saying that okay, this is the best for me, right? So I got a decent average 50 score, but I could get an MBBS college like anywhere in India with that score, but it was a private thing, not a government thing. So honestly, my parents couldn't afford that much fees, like 1 CR or 2 CR only for the like graduation thing, and I also didn't want to bother them with all of that. So I thought, okay, fine, chalo, 5 years hai, matlab, it's okay, we can do something which is like unconventional, which my family has never done. They have not produced an dentist right now and all. So I thought of doing BDS ki chalo dekhte hain kya hota hai isme, like what do they actually teach in all those 5 years, na? So that was mainly my rasta to BDS.
So there is this, I would say, stigma or myth attached that being a doctor and being a dentist are two separate things. While we were having our conversation, you gave me a very surprising fact that you have to study MBBS in BDS.
Yeah.
So,
We also have to, study anatomy, the physiology and the biochem and everything, the pharmac, which they also study. But we are not doing it on a very deep level. We are doing it only just a superficial level. But at least we are studying it now. But still, there's this myth attached that okay, dentists are somewhat inferior to the MBBS doctors and everything. So that myth should actually change. That thinking, that mentality of the people should change.
so now you're doing, you're preparing for your master's, and you told me that what, there are 8 specializations.
There are 9 specializations actually.
Specializations, man. Okay, and what are all the myths that you come to encounter in your internship? What is the most
There are
common?
actually the most common that I actually get it from my parents as well,
Yeah.
they say that just ask them to go to a dentist and get the cleaning and everything done, like the scaling and all, because they have never been to a dentist.
Yeah.
Okay. And so they said to me that no, we are not going, and our teeth will become mobile, and just they will pop out of her mouth and everything. So I was like, no, it's nothing like that. People have this misconception that if they get the cleaning done or the scaling done professionally with the machines and all, they will have sensitivity of teeth, or the teeth will become loose and they will just pop out like out of nowhere and all. But I just want to clear this out over here that this is just like totally baseless. Because if you get the cleaning done, like you just get your house clean also, right? You clean it every day and stuff. So this professional cleaning is like, I'm not saying you do it every day or like every month or stuff, but at least get it once in a year. Because we as dentists also do that. We also go to another dentist to get our cleaning done, man. So why can't you do that? So because that is very important, because if it is not there, matlab, if that the debris and the food and everything will get accumulated, and that will basically become a habitat for the bacteria to develop, and that will basically lead to many problems, like you can have gum recessions and gingivitis and everything. So inflammation will be there, pain would be there, and then you will say, okay doctor, I'm having that bleeding in the gums when I'm brushing, and then I don't brush and stuff. So it can lead to many problems.
Right. Okay. So, do you think that brushing twice a day is enough, or do people need to do more for their dental hygiene for by their own selves?
I would really like to emphasize a point over here, Akash, that more than just if you're just having the mouthwashes or you're just doing the flossing and everything, that is basically, a added, or you can say an adjunct to everything. If you are not following the proper toothbrushing technique, then it is not going to benefit you. So I would really recommend people to just go on YouTube and just see the proper toothbrushing techniques which are there, which is really recommended by ID and everything, and specifically the modified bars technique. That there's a name, the modified bars, that is actually very helpful for for the general population who are just like in the age group of like 15 to 80, 15 to 80 years, that's like that. So just go on YouTube, see the toothbrushing techniques, because if you're even using an ultra soft toothbrush, or you using a toothpaste which has like less abrasive content, or even after all of this, if the technique is not right, then it's not going to benefit you.
I have seen a lot of people who neglect their cavities once they start having them. What are the consequences? Because then,
there's a thing that if once a person has a cavity, right, then it's like this conception, okay fine, when the pain would be there, or when I'll have the sharp shooting pain, then I'll go to a dentist and everything. They don't come prior to it. When they see a blackish discoloration on their teeth, or when they have some like mild sensitivity and everything, they won't come to us. They would come to us when it's already the infection has crossed the nerves, and it is in their like swelling is there, and the pain is like so much that they can't even sleep and everything. Then they will come to us, and then they will say to us that, okay, you just save our tooth. So then we tell them about like, okay, the RCT has to be done and everything. And then they say, oh my God, you have just, told us about that. So much amount of money has to be spent on it. And then they say to us that we have to go for 4 sittings and everything. So we can't do something if you don't come to us on the initial stage, right?
yeah.
Because I would just say that prevention is better than cure. So if you are preventing it, and if you're following the normal healthy practices which are required, then you won't be having some futures and the problems in the near future.
What amount of damage can smoking do to your teeth? Like when you see packets in cigarette, you see that photo of I guess Mukesh and his mouth. So is it true that
Oral
something like
cancer.
that can happen?
Yeah, see, smoking and diabetes, they are two things which are actually, the people who smoke and the people who are diabetic, they should be extra cautious about their oral health. Because see, diabetes is like, it's going to affect your whole body. So it's going to affect your oral cavity as well. because both these things are interrelated, right? And smoking also, if a person is smoking, I would say here that your oral health, and if there is some cavity or there is some lesion which is growing in your mouth, that risk of getting that oral lesion can actually increase like by 4 to 6 times. So if that number is like 4 to 6 times more, I think you should be more concerned about your oral health. And firstly, shouldn't do the smoking in the first place, right? Because you know that it leads to oral cancer and it leads to like fibrosis, and your mouth cannot open. So if your mouth cannot open, how will you eat in the future? So
Yeah,
I
you told
think they
me
should be
about
really
that
cautious about it.
mouth tobacco thing, that when people in villages consume a lot of tobacco, they don't know that their mouth stops from functioning, opening itself.
They know everything, Akash, but they don't, they don't pay heed to it. They just want, okay, fine. They are getting that fun out of it, that, okay, they're smoking and they're having that tobacco thing and everything. There are many ladies, like in the lower socioeconomic status, the
Right.
people who actually take tobacco and supari and everything, they just keep in their gums and they think that, okay, fine, the tooth pain is going to be relieved by it. But that is actually a misconception. Maybe it has some things that maybe when it leaches out, maybe you will feel some, fantasy or euphoria or something like that. Or maybe it has something which will momentarily relieve the tooth pain. But that is not going to benefit you in the long run, right? Like some people take aspirin tablets and they just keep it in their mouth. But that is actually very detrimental to you. That is actually more harmful than useful for you, because it will cause burns and everything. There are a medical condition called as aspirin burns. So that is like very painful and it
Why
will
do they do
discolor
that?
your mouth. And what?
Why do they keep aspirin in their mouth?
Because they think that it will relieve the tooth pain.
Okay. Okay.
So they have supari and alum and something, whatever those desi nuskha the people have. So that is all a myth and misconception. You shouldn't do it.
Okay, in our talk, you also discussed that when people lose all their teeth, they just, instead of swallowing it, chewing it, they just swallow it, the food. So how harmful can that be?
See, the people who lose all their teeth and they become edentulous, that's a term, edentulous,
Okay.
they will basically, the ridges that we have, like on which the teeth are going to be supported, they are going to get, resolved with time, because there is no force which is acting on it. There is no support, there is no teeth over there. So when the ridges get resolved, the facial profile that you have, because you have the lip support, you have the cheek support and everything, right? We have the ridges support. So if that is not there, the facial profile is going to change. Your mandible will, the lower jaw will basically be retarded in something, and you will have that convex profile, and the normal straight profile that you have, that is going to change. So the people don't know that actually your facial aesthetics are going to get compromised if you don't have teeth and everything, because teeth is a very important part of your whole body system. Like you eat from that, man, you are just surviving because of it. You are eating the food and everything. So the people who have long-term edentulous and everything, they should get their dentures made and everything, because that is going to help them for eating also, and the facial profile is going to get maintained, the lip support is going to get maintained and everything. The lip
What
fullness is
about
there.
the food that goes undigested, unchewed into the digestive system?
See, that is also gonna affect you, because obviously if you're not chewing properly, because we always say, no, like our mothers used to say that chew the food properly and then just swallow it. So if that is not there and you're eating that raw food every time, or obviously your stomach acids and everything, they are gonna work over time, and things are gonna get very harmful for you.
When you performed your first surgery, like you saw your blood and all, were you nervous? Were you scared?
Actually, people usually think that they will get faint or something when they see the blood, but actually I love that thing.
Yeah.
I actually, when we do the extractions in our college and stuff, and when we are assisting in the major OTs and everything. So I think that is very exciting, and that makes you like, okay, fine, you're doing something like really interesting, and you're, curious to know more about it and do something which is really good. So I really love all that part.
Can you tell some of the medical advancements that have come in the field of dentistry? over the years?
The advancements are like, there are quite many, like lasers are there.
Okay.
Like my brother recently had a surgery. He had a like frenum in the mouth. That is, he got the frenectomy done, because that frenum is like a muscle mass that is gonna come in between your incisors, like the two teeth which are in front, and it will cause the spacing. So he had this thing done, but initially, like in the conventional technique, if you follow, that is gonna done by like incisions and with a scalpel and blade.
Yeah.
But now it is actually done by lasers.
That is
So that is very good.
okay.
That is like a very good recent advancement in industry, that lasers can actually do anything. Like they can, create a bloodless field for you, and that would be a painless procedure, and it is going to heal in a very, short amount of time. So lasers are there. Then secondly, lasers are also used in depigmentation of your gums who have, blackened gums. That could be used there. And many machines are there which can actually help you in the RCTs. And then facial aesthetics is a growing branch in this thing, that we have some, derma fillers and hair transplants and Botox injections and everything. So there are many things which are actually, and implants are like the biggest, safe for the people who can actually afford it, because they're going to stay there for like 10-15 years, and then you just forget about it. It's going to be like costing you initially, but it's going to be there like for. And another thing would be, I recently came across something which is known as Invisalign.
Sorry?
The Invisalign.
Okay.
The Invisalign is something which is like the clear aligners, like the braces and stuff that you go initially get now. If you are like a older person, like you are in your 40s and 50s, and your growth is like complete, obviously you're not growing. So in those patients, we actually give the Invisalign, that is the clear aligners, and they would actually help in the movement of your teeth, and they would actually create spacings and everything. So they will help in if you have crowded teeth and stuff. So that is very good, that you can wear like for 14 and 16 hours a day or maybe more, and you just need to remove it while you're eating. So the people who are in front of you, they won't actually get to know it, that you have something in your mouth, because they're all transparent. Yeah.
Yeah.
They are going to cost you like 1.5 lakh initially, but they are really good.
Right. But better than braces if you want to that aesthetic look.
Yeah.
Speaking of aesthetic, when we had that talk, you said that dentists can also perform Botox and hair transplant and things like that. Can you elaborate on that?
Actually, I'm really new to this thing right now. I don't really know much, because I really want to do some, certification courses and all of this. I've seen my seniors who are actually doing all of this. And that is, the people usually have this conception that, okay, only a dermat person can do this, like a dermatologist doctor who is, doing all of this. And I also used to have this conception, but then I saw my seniors doing it, and they are, that is something which is really good, because our forte is not just the mouth. Our forte is like the full face, okay, the head and neck area. And whatever we are dealing with, it is like something that's going to benefit you as well and us as well, right? So I think that's really nice.
So you can look after the taste buds as well, the gums, the teeth, obviously, lips as well.
Yeah.
That covers a lot.
And we perform the surgeries on the lips and everything. Now the people who are there are patients which are called as the cleft lip and palate patients. Okay, which are born like with some deformities in their nose and their deformities in their lips. So we perform the surgery on those children like who are 6 to 8 months old and everything. So it is not just that we are looking in your teeth and doing the oral cavity. The oral and maxillofacial surgeon, he actually, who specializes in all these surgeries, after the MDS, he can actually perform all those surgeries on you, and can, if there are also the mandible, if your lower jaw is back and your upper jaw is in front, and you have a profile that is not very pleasing and aesthetic to you, then the oral surgeon can actually treat that as well.
So people have this misconception that dentists are only related to teeth.
Yeah, they have a big misconception about many things, I think. related to dentistry.
What are the things that people should avoid, like if they want to have good teeth, white, bright, shining teeth?
See, I think first thing would be pointed at you also. I think it specifically for you, who the people who are taking, very much sugary drinks and carbonated drinks every day.
Yeah.
I would really suggest, see, Pepsi and all, I also drink. Okay.
Yeah.
But we as dentists, we recommend people to limit the consumption. It's not like you're drinking it every day and stuff. Na? Matlab, obviously, that thing is going to be harmful for you in the long run because it actually causes the erosion of the teeth.
Right.
And that is going to cause sensitivity in the future. And then that's not the benefit. The benefit is like nothing.
Yeah.
You're just getting that, okay, that caffeine you're taking, and that's it.
What about all the coffee stains and the smoke stains?
See, coffee is something like coffee is like we drink and we, that is somewhat, it's like it's having the benefit as well. It's harmful also. But these sugary drinks are nothing but just caffeine and sugar and all of that. Now, so that is not going to benefit you. If there are coffee stains or smoke stains, that can be easily removed by that scaling and polishing and everything. So that's not an issue.
So people also have this myth that if they smoke and their teeth get fucked up, that they can go to a dentist and they'll patch them up and it will be back to normal. So is it the case?
No, it's not the case. Honestly, smoking is something that you should really be avoiding because it's not only affecting your lungs and the general systemic health, but it's affecting your oral cavity also. So I don't see a benefit to anyone who's smoking really, because if your teeth are not there, if your lungs are not there, how are you going to survive, man? Just think about it for a second. And you're also harming the other persons who are around you because they are passively smoking. So who is getting benefit from all of this? I really don't know.
What about alcohol? Does it have a negative effect on teeth or gums?
Alcohol, to an extent, like it's just like the same thing as carbonated drinks. It's nothing more or less. It's just the same level. But like the effect which the carbonated drinks are.
Doesn't the mouthwash also contain alcohol?
But it is in a very limited amount. A very limited, like 0.2% or 0.005%.
Really?
It's like that. Yeah.
When I stopped drinking, my parents grounded me and I could not go out. I just took a sip of mouthwash. I thought I would get that bug.
Oh my God.
I went to the dentist. He told me that there is no use of flossing. I would like to clear that up.
See, if the flossing is going to help you if your teeth do not have spaces, like if the teeth have tight contacts.
Yeah.
Okay. So in those tight contacts, when the food debris gets accumulated and stuff, so in those areas, in the interproximal areas of your teeth, if you're flossing, that is going to benefit you.
Okay.
But if you have wide spaces in between your teeth,
and
then in those cases, the flossing won't help because it's like no point, because that is just a string. Like, so in those cases where people have spaces, you can actually use those interdental brushes. Like my mom has spacing, like she has generalized spacing in her teeth. So flossing won't help her. But my dad uses the dental floss because he has tight contacts.
Right.
So the people who have spaces, they can use those interdental brushes which actually come after the meals. So that's going to benefit them.
Okay, so the marketing that has been done nowadays, that there's this, I guess, Listerine or Oral-B plaque remover that every time you take lunch, also you should mouthwash or you should brush your teeth. So isn't that too abrasive?
I think, see, these mouthwashes should actually be used in a case where you are actually, if you are having some surgery of the gums, like you have the receded gums and then you are having a surgery for upliftment of the gums, you can use those mouthwashes like for 3 months after the surgery. That's fine. And if you are a normal person and you're using those mouthwashes, I wouldn't recommend you to use it for a longer period of time because they, in the longer run, they actually cause staining of the teeth. So that's not going to benefit you. So if you really want to keep good oral hygiene, you should just follow some simple things. Like first would be the toothbrushing technique. Then second would be like just obviously wash like toothbrushing twice a day. And apart from that, the flossing you can do if you really think that the food is getting stuck in between your teeth and you have tight contacts and everything. So I think that is more than enough for anything. Just limit the sugary foods and the sticky foods, because if you're using the sticky foods and everything, so that will that is going to stay there on your teeth, and that is going to lead to that caries and everything and the destruction of your teeth. So you should avoid those.
And what about
And
mints?
also I would say that in between meal times, like we have this thing in between snacking. So in between, if you're having the chocolates and everything, that is also harmful for you. If you're taking the chocolates with your meals, that is like fine, because then you're gonna just wash your mouth and everything after the meal. That is gonna be fine. But you're drinking water, and that is gonna just remove all the debris that has stuck there. But in between, if you're having, so you're not having water after eating the chocolate, right? So it's gonna stick there and it's gonna stay there. So that is more harmful than having it with the meals.
And what about mints and those sprays that you get for those Listerine patches also? Are they like harmful?
I wouldn't say they're harmful, but what's the use? I mean, those mints are okay, fine, but anything which is sugar coated is not
exactly. Yeah. Okay.
So that's not gonna help.
Achha, what is the difference between cleaning and bleaching?
See, cleaning is basically removing the food debris and the plaque and everything from your teeth with a ultrasonic machine or maybe the hand scaling. Both are just like normal, and you remove the stains and everything. Bleaching is something which is done for the whitening of the teeth. Like if you have discolored teeth, or if you think that you have yellowish teeth, and you really want to whiten your teeth to have a like big bright white smile, then you can do the bleaching.
Okay, so yeah, you have written that dental treatment should be avoided during pregnancy. Why?
Yeah, that's a big myth that people have, that if a lady is pregnant, that she can't go for the dental treatment and everything. But that is gonna depend on what trimester she is having. Like if a person is having first trimester or the third trimester, then she can't have the dental treatment, because she can't take the painkillers and everything, because it is going to affect the baby in the future. But if she is having like 4, 5, 6 months, that is the second trimester, that is safe for the like normal routine procedures. Like she can get the scaling done, or she can get the polishing and bleaching done, or like simple extraction can be done of the teeth if she is having like pain in the teeth and that really needs to be removed. Then in the second trimester she can go for it.
I wanted to talk to you about anesthesia. Like you cleared my doubt that you provide local anesthesia, so that's relatively safer. But is there any side effects to that as well? Like the person has their eyes open, so can they feel panic that their teeth is actually being removed?
See, when the people come to us for extraction, they're already very scared of it, right? Obviously, any person would be like, they're getting their teeth, extracted and all. So that panic and the anxiety that is in their back of their mind, like from the start. But when we actually tell them that okay, it's gonna be painless and everything, because we are delivering the local anesthesia and everything, so that is gonna see in like moderated amounts, that is not gonna affect him or her. But there is something which is called as LA toxicity, like local anesthesia toxicity. So that toxicity could be there when repeatedly some quack or something is gonna do your extraction, and he doesn't know about the levels, that what amount should be given in the injections. And if he injects like more than the required amount, then obviously it can affect your CVS, like the cardiovascular system. It can affect your heart, it can affect your brain. So it can have many things, like you can have convulsions, you can have the pain in your heart and everything. So that's there.
In villages, ad आते थे ना, people वो क्या खाते थे, वो हर एक रंग के that दंत मंजन.
Yeah.
I don't know.
Toothpaste.
No. वो स्टेम सा कुछ होता है ना, जो चबाते हैं.
अच्छा, okay, that twigs.
हाँ.
Of the bark of the tree, something like that.
Yeah.
वो dant manjan is also not going to benefit you. It is going to cause more harm than benefit, I would say. Because all these desi nuskas, like I told you, na, that supari people keep the tobacco that they're eating and they think that, okay, the pain is getting subsided momentarily. So that's not going to benefit anyone. If you just need to have a proper soft toothbrush, that's it. Normal plain toothbrush without any hard bristles or anything. Because people have this conception that if the toothbrush has hard bristles, then it's going to clean more because it's hard. So that is not going to be there. Just use a normal plain soft toothbrush. And secondly, just use a normal like Colgate or Pepsodent or something. Not like the Dabur Red and everything. And I don't think so it's going to benefit much, because the fluoride content in that should also be the optimal fluoride content should be there in the toothpaste.
Yeah, but marketing,
because fluoride is also important for a teeth.
Exactly, but in Ayurvedic marketing, people say fluoride is bad for you. It will do this or that.
Fluoride in the excess is bad for you.
Yeah.
Because you see, in excess, it will also cause fluoride toxicity and everything that is going to benefit, that is going to harm you, obviously. But if you have a toothpaste, and you don't need to take like large amount of toothpaste when you're brushing, right? People have this misconception also that more toothpaste that they're having, it's going to clean more. So it's not like that. You just need to take a pea-size amount. Honestly, only a pea-size amount in the morning, a pea-size amount in the night, that's going to benefit you enough.
Right. Okay. So some of the myths that you wrote, I'm going to ask you. Removal of upper teeth affects vision.
Okay. See, I would really like to say to people that vision and extraction, they are both unrelated terms. Okay. If you're getting the extraction done, we are delivering the local anesthesia properly in moderated amounts and everything. So it's not going to harm you anyways, and it is not going to affect your vision at all. So please, if you have decayed teeth, what?
Why is there this myth?
People have myths about anything, Agarsh. There is no logic behind myths. Na? That is why they are myths.
Right. Okay. Professional cleaning or scaling loosens the teeth. I guess you covered. Yeah.
I covered.
Dental procedures are always painful. Anesthesia.
Yeah, anesthesia is there. You're not going to feel pain.
Avoid during pregnancy. Achha. A child never needs cleaning of milk teeth because they will shed off soon.
Yeah, see, people have this, notion that we don't need to care about the milk teeth of their children and everything. But I would like to emphasize a point over here that the primary teeth, the milk teeth that you have, they are basically the foundation of your permanent teeth. If the child loses the teeth prematurely, or if it is going to be retained for a excess amount of time, both of these conditions are going to be harmful, because if the child loses the teeth, there is going to be spaces.
Right.
And those spaces are going to, close with some amount of time, and then the permanent teeth won't have space to come for the eruption. Okay. So that will basically lead to a condition which is known as crowding of the teeth. So the patient has to, go for a future orthodontic treatment, that is braces and everything. So that is not a very, good situation for the kid as well, because he loses the front teeth and everything. And, that psychological stigma is over there, that people are, just making fun of him. Oh, you don't have the front teeth and everything. So it is going to affect him mentally, physically, emotionally, everything. So all these things are related.
What about nutrition for growing kids in relation to their teeth?
People also have this thing that they don't brush their children's teeth, because they think that brushing is not required, it's just milk teeth, and that's okay. But I would recommend that you should, just even if your child doesn't have the teeth, even if it has not erupted yet, you should just massage those gum pads that you have, of the children. You should just massage them, and just normally, not by toothpaste, but just massage them, because it's going to get clean, right? Because he's also ingesting the food and everything. He's also having milk, which has some amount of sugar and everything. So you should really brush, just think about it, that you should focus on brushing as well of their teeth. And what did you ask?
I was asking about nutrition.
Nutrition.
Yeah.
I would like to emphasize this point over here about the breastfeeding and the bottle feeding. If The breastfeeding is like for 3 to 4 months, that is going to be beneficial for the child. But if there is going to be continued bottle feeding, like the child is on the bottle for like 3-4 years and everything, that is very, very harmful for the child. Okay, because it is basically going to lead to like forwardly placed teeth, and he is going to have some orthodontic problems in the near future. So the recommended time for bottle feeding to stop is basically 1 year. So after 1 year, you shouldn't give it. You should give him, cup of milk to him, like in a mug and everything. You should just stop it after 1 year.
Okay. And what if a person who does not have baby teeth, like full grown teeth, loses them? It cannot grow back, right?
No, it cannot grow back. Then in that case, you will just have to go for a prosthesis and rehabilitation, like with an artificial tooth. Like you can go for a removable thing, like you have that plates kind of thing on which the teeth are attached, and then you can remove it and just do that. Or you can have the fixed wala thing. You can have those bridges, like they take the support of 2 nearby teeth, and then they fix a bridge of like three span or 5 span kind of thing. Or you can have the implants. Okay. Depending on how much you can afford, you can just take a choice.
It costs a lot, right?
The implants would cost a lot, yes, but if you're going for the fixed wala thing, that is manageable.
And what is the cost of bleaching, like whitening your teeth?
See, in the metro cities, it is very costly, but if you're not in the metro cities, then I think it's fine.
Then if a person is not in a metro city, I don't think that would be the priority.
See, bleaching is something that I don't think so is really required. If you have really, yellow teeth and everything, then in that case, you can go for it like, like if you're going for a party or something, or if you have your marriage planned or something and you really need to look good, then you can go for it. But routinely, if you are doing it, I don't see a benefit of it.
So what is the advantages of braces? Can you like explain as a layman to a layman?
See, braces would be required only in those conditions where your facial aesthetics are going to get compromised. Okay. If like you have forwardly placed teeth, like in the upper jaw you have forwardly placed teeth, and your mouth is not. There are many people where the mouth competence is not there, like the lip competence is not there. The lips are not gonna touch with each other. So the mouth is going to remain open and they have like really bad aesthetics. So only in those cases where the patient feels that, okay, he or she is not feeling good and everything, then they can go for that. And if there are some cases like crowding is there, like the teeth are like just like transposition like this, that they are just so crowded, and that could actually lead to more bacterial accumulation, more plaque and everything. So that is not going to benefit you. So in that case, you can go for braces.
And what about the self-esteem of the child who has braces? Does that
see basically, I think in the past years that used to affect the child a lot, but I think it's like a fashion or a fad right now that, okay, I should get the braces done. My peers are getting the braces and stuff. And I think it's normal for us, because in my time when I was in school and my brother got the braces, then he was very, conscious about it, that I have the braces and everything. And his friends used to mock him about it. But I think now the situations are changing a lot. And now the braces are like fine, that okay, if you're getting braces, it's fine. And they actually, tell the dentist about like they want a pink color of the brackets and everything, or they want a multicolor thing or stuff. And there are many, variations in these braces as well right now, like the transparent one or the multicolor one, or like the silver ones or the gold ones. So I think that's not a stigma right now.
I think rappers are also glorifying it by golden braces and all. Yeah. So one more question you have written: when gums bleed, it is better not to brush teeth.
Yeah, people usually come to us and say that their gums are bleeding a lot, and they can't, and it's very painful for them to, brush and everything. So that's why we are not brushing. So I would suggest those people to see the cause of the bleeding gums is because you are not taking proper oral hygiene. right? Because the bacteria have accumulated and it has it leads to the loss of attachment of your teeth, and the gums have receded. So that is why, and the gums are swollen because the infection is there in the gums.
Right.
So that is going to affect you, right? So I would say that if the gums are bleeding, you should visit a dentist. He would do the scaling and everything. He would remove all the debris which is stuck on your teeth, and he would prescribe some medications and stuff. And the gums, if the proper scaling and everything is done, if the cleaning is done, your gums are gonna get back to normal. After like 4 or 5 days, it's gonna subside. The inflammation is gonna subside with some medicines, or even if you're not taking medicines, it's gonna subside.
Right. What is the relationship between weak gums and heart?
Weak gums and
Heart. Yeah.
See, like I said, just like the diabetes and the oral cavity is connected, the heart and if the patient is having is a cardiac patient, right? Or he has some pacemakers or stents which are there in his heart. So we as dentists have to be extra cautious in those patients. Like we have to give them morning appointments, right? And we have to be sure of what?
Why morning appointments?
Because the blood pressure and everything that is gonna, the fluctuations are gonna be more in the afternoon.
Right.
So that's why we have to give them morning and short appointments and everything, right? And the diabetic patients, they cannot stay for a longer period of time. So that's why we have to look for it. And also there is another thing that when we do the ultrasonic scalings and everything now, we cannot do it in a patient who has a pacemaker, because those electrical activities are going to hinder each other. That's why you have to do the hand scalings and everything.
Yeah.
So, and in the extractions also, because if he is a heart patient, he is going to have excess amount of bleeding and everything. So first we actually look for the blood pressure is in the, the optimum amount of range which is there. If it is not there, then we advise him that, okay, you take the medicines and then you come when the blood pressure is going to be normal. So these things have to be taken care of.
So people who smoke, they are given that stain removing toothpaste. Like, does it work?
I have really not heard about it, honestly, that stain removing thing.
I think it's just a marketing tactic thing.
Yeah, there are so many marketing tactics that I use.
There's this charcoal powder that whitens your teeth and
whitens your teeth.
Yeah. Okay. Another myth: keeping an aspirin tablet or clove or alum.
That I think I've covered.
Yeah. Okay. So, last question I would like to ask you: what are your further dreams and goals ahead as a dentist?
See, firstly, I really want to finish my master's first.
Yeah.
And then I am thinking of doing something in the facial aesthetics and hair transplanting. Okay. And then the main thing that I really want to do is mainly to set up a clinic which actually gives free medicines and free treatment to the poor people. Because that is something that's, really close to my heart, that if I'm helping people, I should be helping those people who are in real need of it. Because honestly, even if the person is having a high socioeconomic status, or if it is of a low status, people are actually not concerned about their oral health. Even in the metropolitan cities, I have seen people, even in my own family, I have seen people that they are not concerned about oral health. They don't pay heed to it. They don't give much importance to it. They just think, okay, fine, theek hai, daant hi to hai, how does it matter and everything. But I think part of the reason why this behavior is there is because people are not aware. That awareness is somehow lacking in the Indian mentality, in the Indian setup, that people don't know that, okay, fine, if they do this, how it is going to affect them. If they don't do this, how it is going to affect them. So so the main thing that I want to do in the future is to create more awareness. That's the first thing.
That's why you wanted to make this video, right?
Yeah, the main thing was to, just talk about all the myths and the taboos that people have and everything. And so I really want to create awareness. in everything I do. Like I also tell people that, okay, you can message me and DM me anywhere you want if you have some doubts about it or something. If you want to ask something, I'm freely available because I'm a doctor, and I'm a doctor not because I just want to earn money. It's not about the money. It's more about the passion that you have for treating people.
Right.
And I think it's inculcated in every doctor out there who's doing their job properly. I think it's there because we are here to serve humanity. And so that's why I want to create awareness. And the second thing would be to give the free medicines, because these medicines are actually very costly and people don't buy them. Yeah. When we tell them, okay, just get this mouthwash and get this toothpaste or something, it is going to help you with the sensitivity and everything, they don't buy it because they can't afford it, because they have much more better things which they want to invest on and everything. Obviously, maybe there's a student, maybe the son's education and everything. So that those limitations are always going to be there for them, and that is not their fault. So I want to help those people that, okay, I'll be giving the free RCTs and everything, and the things which are actually there in the dentistry, they are very costly. The treatments that we are doing, the materials that we are buying from the market and then placing in your mouth and everything, they are costly, and those people, they can't afford it. So I really want to do that in the future.
It's really nice, man. So it was really nice talking to you. We'll stay in touch.
Yeah, same here. Same here. Okay.